Our young people are slipping through the cracks when it comes to mental health. New data from the Mental Health and Wellbeing Commission shows more young people are experiencing mental health distress, but fewer of them are seeking professional help for it. Karen Osborn is the CEO of Mental Health and Wellbeing Commission, joins us this morning. Karen, good morning.
Morena, Ryan.
So what's going on with young people? Is there no help available, or are they just not going to seek it if more of them are in distress?
Yeah, so look, this new report gives the latest updates on how we're going in terms of access to mental health and addiction services. So there's some good news in here. So we're seeing overall more people are accessing specialist mental health services, and many more people are accessing primary and community services. Wait times are improving, and that's largely due to improvements in workforce. But look, we're particularly concerned about our young people, the sort of 19 to 24 age group. So we're seeing that many more of those people are able to access those primary services, but fewer are being seen in specialist mental health and addiction services. So look, we know that youth mental distress rates are increasing. That's been a longer term trend. And so it is really important that we have those early intervention options for people, but also they can access the services and supports when they need them.
So Karen, actually what you're saying is, and let's put young people aside for a second, for most people, well, for the overall population, specialist and primary both getting better access to, great.
Yes.
Good news.
Good.
Finally.
It is.
Good.
It is.
Yay.
And it's largely due to workforce. And so seeing
we've got more people.
Really more people in services. So those initiatives that have been put in place to reduce the number of vacancies, recruit more staff, have new different types of roles, including peer support workers, that's making a difference, and we can see that.
Hallelujah. When do you see that, or when would you expect to see that or carry on into people actually feeling better and, us seeing fewer self-harm and suicide stats, stuff like that? How long does it take?
Yeah, look, it takes time. There's no doubt about that. So what we're seeing is these really early signs of that shift. So those bigger issues around suicide and self-harm, those are big complex issues that have multiple drivers. Not all about access to services, but that certainly makes a difference, in particular for crisis services. So it will take time, but what we are seeing for our young people is that there seems to be some barriers to access to those specialist services. So a lot more options for them in community, primary, online options, but just we need to understand more about what those barriers are to getting access to those specialist services.
What do you suspect it is for the young people, Karen? Is it that they don't like going to see someone in person? Do you need to have a specialist appointment that's on Zoom, or I don't know? You can probably do that already, can you?
Yes, you can. And look, we know young people want different options than the traditional options. So more online options, more options that are community based, that have youth peer support workers as part of the service options. That young people also want kaupapa Māori, Pacific, Asian options that are going to better meet their needs. So there's a bit more work to do to understand what those barriers are and how we can really lift that access further.
Karen, appreciate your update this morning. Thank you. Karen Osborn, who is the Chief Executive at Mental Health and Wellbeing Commission.